All right.
Well, I think I'm first. Is that right, Gina?
Well, good morning and welcome to Senator Wishart, a legislative incumbent candidate from District 27. Thank you, Senator Wishart, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and with us today are lead advocacy volunteers from AARP, Susan DeCamp, Bob Lassen, Danny DeLong, and our state president, Dave Holmquist. Emily Wick is also joining us from the state office today. Senator, we appreciate your time to meet and discuss issues of importance to the 50-plus voter in Nebraska. And as a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Senator Wishart, if you want to start us off by giving us a little background about yourself and your campaign in maybe a 5-minute or less time period, that would be great. And once we've completed your opening, we'll move into the questions.
Okay, great. Well, hi, everybody. Thank you so much for having me here today, and for all of those of you who are watching, hello. My name is Anna Wishart. I am the senator that represents the great District 27 in Lincoln, which is all of West Lincoln. This is actually a district I was born and raised in. Senator Diana Shimmick, who served our state for 20 years, was my senator when I grew up. And so it's just been an absolute honor to serve this district. It's one of the kindest districts. And again, it's just been an honor. You know, when I went door to door 5 and 6 years ago now, knocked on over 20,000 doors. And one of the things that really stood out to me was one, that District 27 has a growing senior population, but also that the face of poverty in the district were senior citizens. Not just poverty, but also isolation, and sometimes extreme isolation. I remember I would knock on someone's door. I was the first person that they'd seen in over a week. And we would sit and talk about just the struggles that they have. And so when I went into the legislature, I was determined to be a voice for seniors in our state being able to age gracefully. It's very important to me. So one of my first bills that I worked on, and I worked on this with a woman named Rosalie, who'd been working on this issue for over 17 years after her husband had not had a great experience in an assisted living facility due to his inability to have access to a nurse. And so she'd worked for 17 years in trying to get this bill passed. And it was brought to me by her as an idea, will you try this out? And I worked with the AARP, I worked with the Nursing Home Association, Assisted Living Facility Association, a lot of other healthcare organizations, and ended up getting Senator Mark Coulterman to prioritize the bill. He's a Republican from Seward. It was incredible. He prioritized it and we passed that bill. And that's just one example of how I've focused on supporting senior citizens in our community. Other issues that I've worked on, working with senators on eradicating senior elder abuse is another big issue. Senator Matt Williams introduced a bill and I supported that. I have continually co-sponsored bills to eliminate the tax on Social Security because I know that is specifically a tax on low-income seniors. And so that's something that I really care deeply about and will continue to work on. On the Appropriations Committee, I have been a consistent advocate on fighting to increase provider rates so that we don't continue to see the trend of nursing home bankruptcies. And successfully been able to do so and worked again in a bipartisan way to do that. But also worked on initiatives to reduce property taxes, recognizing that property taxes are oftentimes a very burdensome tax on senior citizens, especially lower income senior citizens. So that's been important to me as well. And then most recently worked on some really fun legislation this year, introduced a bill that would allow the cohabitation of childcare centers and senior living facilities, recognizing sort of the mutual benefits of intergenerational connectivity. And so that's something I will continue to work on. And then just in the year of 2020, this has been an incredibly tough year for a lot of people, but especially our senior citizens. it's a time of extreme loneliness, concern for those who are in the high risk category of for COVID-19. And so in my own personal capacity, I've worked very hard to reach out to all of the nursing and assisted living facilities, working closely with the AARP to make sure they have everything they need to be prepared to fight this virus, as well as going and visiting senior living facilities myself. We call them window wellness visits, and I have a horse and I go with a team of my barn friends, and we go and do window wellness visits. And then also been working on a video project with a young friend of mine to tell the stories of seniors, because isolation and loneliness is a huge health risk for seniors as well. And so it's important right now in 2020 that we make sure that we're supporting our seniors as much as possible.
Wonderful. Thank you, Senator. We have provided you with a set of 3 questions pertaining to the 50 plus in Nebraska, and we've allotted 5 minutes for each of those questions. I'm now going to turn it over to our question 1, which for Dave Holmquist, who's our state president, to ask you that question. Dave?
Good morning, Senator. Thank you for being with us. It's a pleasure to have you with us today. Question 1 is helping people stay in their homes and communities. A livable community is one that is safe and secure, has housing that is affordable, no more than 30% of income spent on housing, transportation options that allow individuals to travel by multiple means, and supportive community features and services for people of all ages, allowing people to remain in their communities as they age. What steps will you take to ensure all Nebraskans have access to livable communities?
Oh, that's a great question. And first of all, I'm really proud of the work that the AARP is doing in Nebraska in terms of the Livable Community Initiative across our state. So some of the efforts that I've done, and then some that I'm kind of excited about and will continue to work on. So public transportation is very important for our senior population, but also innovations in terms of transportation. I brought and successfully passed with a bipartisan effort a bill that would allow Nebraska to continue to work on the advancement of autonomous vehicle innovations, mainly in mind with keeping in mind how this would open up mobility for seniors and people with disabilities and our blind and visually impaired populations. So I'm really excited about the progress that we'll see with that. We are now one of the most sort of contemporary supportive states for piloting and working on figuring out the technology to have some breakthroughs in autonomous vehicles. And again, that will be huge for our senior population's ability to move around in a safe way. In terms of issues around sort of seniors aging gracefully in our community, the legislation that I introduced this year, I'd like to talk a little more in depth about. I think one of the most important things in terms of quality of life is opportunities for intergenerational connections. I think communities, and this is disappointing to me, but communities have tended to kind of section people off in terms of ages. And I think that's a huge problem because there's a lot that young people have to learn from those who have walked before them. And it's unfortunate that there isn't a lot of times that opportunity for connection. And so one of the efforts that I'm really focused on is finding ways through policy and that we can incentivize connectivity between younger generations and seniors. And so that was a bill that I introduced this year, actually inspired by Adam's community. They have a nursing home there that included a daycare within it and have had some of the most incredible sort of benefits for both the young kids and the seniors. And so that's something that I would like to incentivize for other nursing and senior living facilities as well. And then the other issue that is incredibly important, and again, this is one that I've been a consistent advocate for, is just access to quality health care. I mean, we want to make sure that people who live in Nebraska can live a long and healthy life, and we're nothing without our health. And so I've continued to fight for the expansion of Medicaid. I've continued to support initiatives that make sure that seniors have quality health care, whether they are living in their own home or whether they are living in an assisted living facility or a nursing home, to make sure that the healthcare is as quality as possible, is as accessible, and then also as affordable. And I have worked on several pieces of legislation to lower the cost of prescription medications, and also to ensure that people who find a medication that works for them are not kicked off of that medication by their provider just to cut costs, when in the long run, it's the morally wrong thing to do, and it also, in the long run, ends up with people having more acute illnesses. So I'll continue to work on those healthcare issues as I move forward, if I'm honored to be reelected.
Thank you. Thank you.
Great. Thank you, Senator. Our second question is under health, caregiving, and home and community-based care. And Susan DeCamp, our lead advocacy, will take that question. Go ahead, Susan.
Good morning, Senator Wishart, and thanks for being with us. My question is on health, caregiving, and home and community-based services. And I know you've already touched upon that a little bit in your answer to the first question, but here's the second question. Caregivers help older persons live independently at home by providing assistance with activities like bathing, dressing, and performing medical and nursing tasks, such as administering medication and wound care. Caregivers often provide these services with little or no training and also little or no pay. Will you support helping caregivers with paid leave, respite services, telehealth, and access to education and training? And how will you protect or expand paid services and supports, as well as financial security that allows more seniors to live independently in their homes and communities?
Well, absolutely. The Caregivers Association and the groups that comprise that are some of my favorite people on this earth. Every year I have had the opportunity to join their sort of proclamation, even getting a chance to read the Caregiver Proclamation. Actually, my husband's aunt is a caregiver, and she's an incredible soul. It takes a real special person to do that work, because oftentimes it's under-recognized and underpaid. And so I will do everything in my capacity to continue to support caregivers. Some of the work that I've done is supporting paid leave, and any initiative that comes before me that would support someone who has had to go through the unfortunate circumstance of having a loved one who is sick and they need to take care of them. The other initiatives that I've looked into is actually allowing for pay for caregivers, or expanding the ability of pay for caregivers, because it actually saves money in the long run when a family member is able to take the time to be home and take care of their loved one. So that's another effort that I will continue to work on and have supported if any legislation has come before me with that. And then in terms of telehealth, I actually support and want to look more into advancements on telehealth supports, especially for some of our rural populations. We've seen the pandemic that telehealth is absolutely integral to ensuring continuity of care. And actually, when the pandemic hit us in March, I was very quick to work with a lot of telehealth providers to push up against insurance providers not covering telehealth, and make sure that there was that continuity of care and that we did have that transition. And I'm looking forward to continuing some of those breakthroughs that we saw this year in terms of telehealth supports, especially around mental health. I think that I think we're going to see an increase, and we already have, in the amount of people who are really struggling, not just with their physical health, but with their mental health because of the amount of isolation that they've experienced. So it's very important to me that even if we continue moving forward with this pandemic next year, that we continue with the breakthroughs we've seen in telehealth to allow for people to have access to healthcare providers in the safest way possible. So I will continue to work on that as well.
Thank you.
Great. And our third question, Senator, is on nursing facility quality, and Bob Lassen, who is one of our other lead advocacy volunteers, is going to take that question. Go ahead, Bob. I think you might be on mute, Bob.
There we go. This is probably a follow-up to some of the other questions that have already been asked and your answers. But in Nebraska, there's an estimated 66,000 people who reside in one of the 21 nursing homes. And by 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000. Due to a variety of factors over the past years, Nebraska has seen an increase in nursing homes having to close and residents having to relocate. It's particularly true in the rural communities. How will you ensure that Nebraska residents receive quality nursing home care, including, again, the home care, including ensuring adequate nursing workforce, education, training, and proper reimbursement?
Wow, that's a great question. I mean, first and foremost, a lot of this has to do with prioritizing provider rates in our budget. Mm-hmm. That's whenever someone asks me, how do we make sure that we continue and improve healthcare for seniors? To me, it means that we as a state, when we have a pool of public dollars to spend, that we invest those in our seniors and the care that they get. And that is something I plan on being on the Appropriations Committee for another 4 years. And I will continue to prioritize making sure that we take care in terms of funding of those who have committed their lives to our state and to our economy and to a lot of the great things that we have in Nebraska. And the least we can do is make sure that they have a safe and healthy place to age. And so I will continue to support seniors as a member of our Appropriations Committee. I've also looked at just the quality of care within nursing facilities. I introduced an interim study on behalf of a constituent who reached out to me this year. I think a lot of challenges have arisen because of the pandemic, but there are things that we should look at into the future in terms of staffing ratios. Again, making sure that our nursing facilities are not only, not going into bankruptcy, but that they're quality, because a lot of people are living a lot longer than they can live independently. But that doesn't mean that their quality of life should not be still a good one. So that is something that I'm working on this summer, is just looking at staffing ratios and looking a little more in depth in terms of the quality of care in nursing facilities especially. And then the other thing I would say is that statistic that you read about the increase in population of seniors in our state. There's another part of that equation that I think is very important as well, which is that by 2030, we'll have more people who are over 65 in our state than 18 and under 18. So if you think about that, that population trajectory is concerning to me, because we need to make sure that we are attracting and retaining young people in our state to build their careers and their families, so that we have enough to invest in seniors aging gracefully. So while I continue to work on issues that support our senior citizens, I'm also working on issues to make sure that as a state we are economically sound and growing, so that we are able to support our entire sort of collective population. And so those are initiatives in areas I continue to work on as well.
Thank you.
Thank you, Senator. In follow-up, does anyone around on the screen have any additional questions in follow-up to those 3 questions, or other questions that you'd like to ask Senator Wishart?
Could I ask a quick question, Senator Wishart? One of the issues, I think, is we mentioned Medicaid and trying to drive that better health care there. We have a hesitancy, I think, on the part of physicians to take Medicaid-related cases. Is there anything that you can think of that would help us to incentivize providers to have more access for Medicaid patients?
That's a very good question. I think one of the issues is the reason that there tends to be, there's a couple reasons that it tends to be hesitant. There tends to be a hesitancy. One is just the rate, the dollars that you receive as a medical provider from Medicaid as opposed to private pay. But I also think that there's a lot of complexities with working with Medicaid that you may not get with private pay. And so I think moving forward, looking at one, how do we increase some of the rates to incentivize more providers to take care of those who are on Medicaid? Because the thing is, I mean, it's a reality. More people are outliving, a lot of people are outliving sort of their retirement. And so people are in a situation where they are needing to rely on some public funds in terms of their health care. And so how do we make sure they have access to that health care? One of the things we did on the Appropriations Committee is fought really hard for an increase in dental services. A lot of people don't think about that as sort of a top priority for healthcare, but actually the health of your teeth has to do a lot with the health of your heart. And so it's very important that Nebraskans have access to dental care. And so one of the things we did on appropriations was try to bump up, some of those provider dollars so that more people would take Medicaid patients for dental care. So that's an example. But then I think the other thing is just trying to find ways to make the system a little bit more user-friendly, so that there aren't a ton of barriers for healthcare providers beyond the cost in serving Medicaid patients. And I think those are both sort of routes we should take moving forward.
Thank you.
Great. Thank you, Senator. We are coming to the end of our interview period. I want to thank you, Senator, as we come to the end of the meeting, and also want to offer you the additional 3 or 4 minutes before we close this interview out. If you have any closing thoughts, comments, or what wishes that you want to leave the group with.
Well, what I would like to say to everyone and those who are listening is, a lot of the legislation that I've worked on and prioritized has come to me by constituents. And so for any of you who are listening in, if there's an issue that you feel needs to be addressed, or you have a very innovative idea on how we can work on some of these policy areas that we've discussed today, please come to me and share these ideas with me. Again, most of the bills that I have prioritized in my 4 years have been brought to me by a constituent walking in my door and sharing with me an experience and a story that was compelling enough for me to bring the bill. And so far, on all of those bills, we have been successful. And it's due to the hard work of constituents and the advocacy groups like the AARP. But there's also something pretty special about working with Nebraskans on an issue that's very specific to helping our communities. And so please do reach out to me. My cell phone's available. You can email me. My staff will connect you with me. So please do reach out. I would love to help. And thank you to the AARP. Thank you for everything you do to support seniors in our community. We couldn't do without you.
Great. Thank you, Senator, again for the time to visit with you and taking the time again to reach out to our constituency. We wish you the best with your campaign, and thank you again for meeting with AARP today.
Thank you.
Thanks,
everybody.
Thank you, Senator.
Bye.
Bye.